It is rare and historic that the Chattanooga area is dealing locally with tornado, high winds, and flooding damage, while also dealing with a nationwide virus pandemic, both at the same time. And while COVID-19 threatens the health of millions of people in this country, around the world, and right here at home, it also presents unique challenges for more than 5 million Americans living with Alzheimer's and their caregivers who cannot totally practice social distancing. Our Latrice Curry has more in tonight's Eye on Health.
For those patients with memory loss who rely on caregivers and routines, social distancing isn't always possible. That's why the Alzheimer's Association has found a way to help patients and families stay close with a little bit of creativity and technology. Meeting in person for regularly scheduled programs like yoga or monthly luncheons aren't possible right now. But that hasn't stopped the Alzheimer's Association from keeping patients and caregivers connected.
A lot of our programs right now are virtual, which means most people would think that they would need a computer to access those things. That is not true. You can also access it just by a phone number.
Those programs for Georgia Alzheimer's patients like monthly luncheons and yoga classes with instructor Kathy Alvarez, who says it's important for those with Alzheimer's and dementia to stay active.
Once you think about yoga, you think about all the components of yoga. So yoga involves meditation, you have breathing, you have movement, and you have postures.
Alvarez, who teaches her class from Atlanta, says all of these components activate a different part of the brain.
So studies have shown with a routine of yoga in their lives that new channels or connections are being made, hopefully slowing down the progression of the disease.
Routine is important for those with Alzheimer's and dementia, but with social distancing measures in place, because of the coronavirus, sticking to the same schedule isn't always possible.
I guess the key is to try to do as many normal things that you can do as safely as you can do.
Alvarez says this new normal has been challenging for both patients and those who care for them, but it's important to stay active and engaged.
I'm a caregiver myself. My mother is in the disease as we speak.
We just do not want people to feel alone, feel isolated, because we are still here and we are still available.
And that story from Latrice Curry.